back. You're watching our special coverage on NDTV marking World Cancer Day with four very eminent oncologists from the Asian Cancer Institute. Let's now actually talk about the public policy response to this terrible disease, because I was reading some Lancet reports which said that public expenditure on cancer actually in India is below $10 per person, and that's compared to $100 in developing countries, developed countries. So, what does that say about our response mechanism, and how do we need to spruce that?
But if you really analyze, US is a $15 trillion economy. We are only a $2 trillion with 4 times as much of an income.
Yeah.
So while a developed country like US can have almost about 30 times as much disposable kind of income at their disposal, we are actually spending more proportionately as per our affordability for health reasons.
Right.
So we probably will never have enough to take care of every cancer patient from the point of government, and that is the reason why the private players have to actually supplement this effort of the government.
Right. But if the private sector comes in, of course it's not going to come in with a only an altruistic sort of approach to it, and India as a sort of developing country needs the deliverance of both affordable and equitable cancer care. So Dr. Parikh, it's a very expensive malady to treat. What's the sort of approach, what's the model that India should follow?
I think it will have to be a combination of both. The very poor strata where cost of medicine, the stay, etc. is looked at, probably the government needs to support it. But then after a certain income, I think the private sector has to step in. And this private sector, which is what Asian Cancer is also doing, is we have the different categories of classes where the treatment is given, where the cost is the factor which is taken into consideration, not the treatment. So be the patient in a general ward in the hospital or in a suite room, the treatment goes according to the disease that he or she suffers from. But the cost gets reduced tremendously.
We have about 300 centers. How many more are needed, and how do you reach every village that needs cancer treatment?
Probably at least every district, if not less than that, even smaller, would need a real good cancer institute within it. But I think what's important, it's not just the building, it's the manpower that's behind, and that's where the problem comes in, because to train and teach and actually get a good oncologist, whether it's surgical, radiation or medical, which are the 3 main arms of treatment, it takes anywhere between 10 to 15 years to get a real good standard of care. So that is where we need to move very rapidly.
Dr. Kulkarni, have you seen out-of-pocket expenditure as something that's actually inhibiting people from treating themselves?
Certainly, of course, if you have to have a technology to be used for the diagnosis as well as therapy, then it will be a costly technology. So obviously we will have to bring down the cost of the technology which can be offered to the patients who are needy and who are poor as well. And therefore the impact of technology is coming up. Just to say that, 3 decades ago we had open surgical techniques which are now changed to minimal invasive, and therefore we come to what is called a robotic technology, and we are now into that, where in last 2 decades there have been tremendous strides made in this, which has not only reduced the cost of the treatment but also reduced man working hours loss as well. So I think that's an important thing which we are doing for the future lies there.
But are people a bit circumspect about giving themselves to a robot, or are they more precise than human doctors?
Well, let me just clear that myth. It's not the robots who operate, it is the people behind the robots, and the robot is controlled robot. It is not that he operates, and there are men behind who are trained skilled workers, skilled doctors who are trained to do that, and they do it well.
Let's talk, Dr. Deshpande, a little bit about what ACI has been doing. It was created by a group of onco professionals for care, research and education. Tell me about your presence, how you hope to expand, and this whole idea about providing affordable care and where you fit into that as a stakeholder.
Yes, the Asian Cancer Institute actually is an initiative, cancer initiative, which was conceived by a group of leading and experienced cancer specialists in 2002. In fact, almost about 14 years back, where these people were very experienced, and they were all from major cancer institutions, and they got together as a group, and then they realized that unless and until they build an independent institution, they will not be able to deliver healthcare to the last mile. our principle is very simple. Excellence in cancer care at affordable cost for all those people who can afford. At the same time, to ensure that those people who cannot really pay, they should not be deprived out of the excellence in the care. So we also have the support of a foundation which helps out these patients who are financially challenged. We in fact approach donors, we approach organizations for their help and ensure that in spite of our foregoing our own fees, these patients are not deprived of their care.
Right.
This is at a locational level.
So you're right now in Bombay, you want to expand?
We are in Bombay, we are also in Bhubaneswar, we are also expanding to other places. And these are the main centers. The hub and spoke model is what we are functioning from. The smaller model is at lower this thing for peripheral care, where we have the Dr. Pendharkar Asian Cancer Institute model, where we invite people in collaboration with the state governments, and we have done this with Madhya Pradesh, we have done this with Chhattisgarh, we have done this with Orissa governments, who have been excellently forthcoming, very supportive. Their health secretaries have in fact visited the center. So all their medical district officers are called in. They are actually re-educated, they undergo CMEs, training for diagnosis of cancer, management of cancer. They go back to their centers, they visit their villages through the health workers, through their in fact Anganwadi workers. They try to locate cancer patients, and all this data actually is sent back on the net to our main centers wherever they are. And the consultants locally actually collaborate with the local centers in the villages, in the towns, so that this diagnosis is made, their basic plan for treatment is done.
I just want to get wrapping up comments from each of you. 10 years down the line, Mr. Parikh, if I can start with you, 10 years down the line, if we are speaking about cancer, what juncture would we be standing at? Especially in India, do you see this scenario as having improved dramatically?
No, I think it will improve dramatically, because as Dr. Deshpande mentioned, with all these collaborations between the government and the private sector, and a lot of support positively coming from the government, we should be in a much better state of handling the patient load that is expected to build up.
Dr. Sharma?
I believe that it will change, but we need to educate population for bringing in good lifestyle change, leaving tobacco mukta Bharat and other things which is very much required to reduce the incidence.
Dr. Kulkarni, in terms of the future of treatment, robotics?
Yes, ultimately for you, actual flexible robots will come up, and ultimately the treatment should become a daycare center, so that you absolutely need not be admitted in the hospital unless of course you are very serious. So I think 60 to 70% of patients could be sent home on the same day, and that's the future. And of course with minimal invasive and robotic technology, that's on the cards.
Last word to you, Dr. Deshpande. 10 years down the line.
10 years down the line, what is likely to, may not be 10 years but 20 years down the line, genetic mapping and maybe manipulation is probably the way that it is going to go. And understand one thing, we live in a flat world today. So what is going to happen in the developed countries is also going to simultaneously reach here. So just as we have the Aadhaar card which has all your details, you will probably have an appendage to it which also gives you a genetic map, and the tendencies of the person to either get a particular malignancy or a disease will automatically be noted, and will probably reach by that time an ability to manipulate the genes to make you resistant for disease itself. I mean, hopefully that will be the ultimate happening.
The future of cancer, that's another debate for another day, but with that we're completely out of time today. We do hope that your understanding about cancer and the precautions that you need to take has seen some value from this special initiative. The disease, as author and surgeon Siddharth Mukherjee writes in his book, may be a laden counterweight to our aspirations for immortality. So the least we can do is fight it out with a little bit of hope and medicine. Thanks for watching. Goodbye.
Presented by Asian Cancer Institute, reviving hopes. Fight cancer with hope. NDTV, in association with Amity University, a leading research and innovation-driven university.